Hello, everybody. Josh Rimany here with your Functional RX podcast. And this week's episode is going to be talking about the things that I use in practice to help treat people that I'm treating in our cardiometabolic program, which we call Empower. My goal for our patients at Dilworth and people that we treat is, evolving them from the pill for the ill society of I have a thing, give me the pill, pharmaceutical approach to medicine only, is to really get them to move towards this functional lifestyle medicine that they can empower themselves to, de-prescribe. That's my new word lately is I like to de-prescribe meds. I don't want to use a pill for every ill strategy anymore. And there's ways we can do that. We use functional medicine and lifestyle medicine to do that. So what's the first step from going, well, I only take medicine to what else could I do for my chronic conditions? That's relatively simple. That's going to give me synergy to the meds that I take and possibly help me down the path where I can start reducing medications. Never reduce your medications by yourself, by the way. I don't endorse that. We need medical professionals to help you there. Your pharmacist and your doctor all need to be in line with that. So I'm not going to get someone off their blood pressure medicine, but if I can reduce their blood pressure to where it's at target and then the doctor agrees, well, let's start to wean that. Well, maybe we can, okay? There are ways to reverse these things.
You're relatively intelligent, I would say. How different is a pharmacist and a doctor as far as education go? Like I feel like you're real close to being a doctor, but you don't have that title. What's the difference?
Well, it's a hard and easy question, but literally doctors diagnose, pharmacists treat.
Gotcha.
That's in layman terms. Like doctors are really good at diagnostics, right? They like tests. Mm-hmm. Well, pharmacists don't have access to tests, so they can treat based upon other things, right? Symptoms, this and that. But we treat the disease. We don't diagnose, right? I don't diagnose. Yeah. If somebody comes in with, diabetes, it's been diagnosed. They give me a prescription. I can label them.
Now
right?
I can help you. Yeah. But if you come in saying I have this, and this, I don't know.
I don't think I would classify myself as a classic pharmacist anymore.
No.
But I do want to, shout out to my pharmacist peeps because guess what? They're the second highest educated healthcare professional.
Right. And that's what I'm saying.
And
like, what's the
so
difference?
Underutilized. Yeah. They all have doctorates. They're just doctors of pharmacy, not doctors of medicine. They both go through 4-year programs. They go through residency programs. They got all sorts of externships they need to have. It's just a different doctor. Okay. Gotcha. So we just don't call our pharmacists by doctor, I am old enough to where I didn't get my PharmD. I got my bachelor's in pharmacy. So I'm not technically a doctor of pharmacy because long story, but somebody dangled a carrot of money in front of me and I decided not to bridge my program, but all the programs now. So I'm dating myself a little bit there. But I've got post-grad studies and certifications in functional medicine. As I'm the 9th to do that through the Institute for Functional Medicine, which I think is the global leader because it was doctor heavy. It's functional medicine. So what we're talking about in my pharmacy and what we're trying to create is a functional pharmacy, right? Which is what we're talking about with cardiometabolic disease, gut, all that type of stuff.
And that's you guys working hand in hand with doctors. Yes. So they say, here's the issues. And you guys say, great, thank you for bringing that to us. This is how we recommend fixing it.
Part of my marketing strategy this year is go to the cardiovascular doctors and go, your patients have cardiometabolic disease. We have a program that teaches lifestyle medicine and helps them eat right, exercise, manage their stress, gives them the proper supplements to go along with their medications and their disease states. Would you think that would be appropriate for your patients since we know you're really busy doing all that hard stuff and all the things that are necessary, right?
Like doctors you be a really good doctor. We're not
replacing them.
Yeah, be a great doctor. We're going to be great at fixing the things that you found.
But we forget when we're diagnosing and treating with just pills, right? Or pills, hey, take this pill. You might want to exercise, eat right. But functional medicine has the science behind all that. So in our Empower program, We talked about that, like what the patient would go through, like nutrition, exercise, stress management, that type of thing. But a big component of what we do in a functional pharmacy is we like to target the nutrients and the nutritional products that we also align with their disease states and the drugs they take. So today we're going to just go through a couple of those, the ones that I use predominantly in my program, that can also help with this type of stuff. So you don't have to be in my program to start your path, right? My pathway for patients is drugs only with personalized interventions from a pharmacist. That's sort of what we call medication optimization. Takes a little bit of one-on-one. We have that at our store. The next phase is adding clinical nutrition to the plan. Mm-hmm. So what can I be doing or taking that's going to be synergistic to my disease state that I'm working on? So fixing biochemistry a little bit, right? And then that fourth phase is really engaging 100% into our programs, allowing me to dig deep, go to the root cause of this stuff, going into our programs, having a nutritionist and a health coach, help them be accountable, help them eat right. That's the full Monty. That's where I want people to go. But I know not everybody either can or has the willingness, whether it's financial, time commitment, whatnot.
Or the mental, some people just aren't ready for that.
Yeah. So what's the step in between, right? Let's optimize your scripts. We can do that all day long. We do that at Dilworth. A lot of pharmacies
Which is
not just fill what you're getting. All right, here's my prescription, fill it, and I'm out the door. Right? We have to monitor.
Hold on.
If you're not 80% adherent to your medication, they don't work. Maybe you're on the wrong medication that's just not as good for you. Maybe you're having issues or barriers or side effects that need to be adjusted. So we have clinical pharmacists that really optimize the patient. That takes a one-on-one conversation. That takes minimum quarterly check-ins. With monthly calls, that kind of thing. It's low barrier. I have a program we've already set up. It's like, we called our annual pharmacy wellness visit and then sort of quarterly check-ins with our clinical pharmacist. It's like $200 plus like $30 a quarter. Like it's so inexpensive, and people can sign up for right now, getting that next phase of just, I take meds and I know what I'm doing and nothing's working. Right. Cause
now I take the meds that are the best for me.
Yeah. We work for our patients. We don't work for the insurance companies.
Right.
We don't work for the healthcare companies.
We want to see you get better.
We work for you. So our goal at Dilworth is really to optimize the patient. So let's optimize you. Go ahead, sign up, do that. Sync your medicines, do all that type of stuff. The next phase is, what do I take, right? What are the extra things? So my goal at the pharmacy is all of our patients should be taking all of our nutritional products, right? Every single one of my patients walking through the door could use a nutritional product for their health.
And we have another podcast we will do about nutrient depletion because of some of the medicines that you're taking. Yes. You could potentially be deficient in certain nutrients, which is where a lot of these supplements come in.
So a functional pharmacy that's doing their job right is identifying two things. Is it a nutritional deficiency associated with the disease or the drug, right? Yeah. So I'm going to go over quickly in this podcast, since we've been highlighting cardiometabolic disease, our Empower program, metabolic syndrome, prediabetes. There's like 5 core supplements, 5 or 6 that I use all the time. We've talked a lot. I think we're going to do a whole podcast on omega-3. It's so good for everything.
I actually know a lot about omega-3. I can help on that one.
It's my top 5 everybody needs. It's in the Dilworth 5. Getting a good quality omega-3 is foundational. I use CoQ10 a lot, a really good absorbable kind of CoQ10. And
you'll talk about that one, I believe, with one of your supplements you're going to talk about today.
Yeah. So those two are like foundational. Can't go wrong. If you have anything, inflammation, pain, energy problems, whatever, those 2 nutrients are really just things that our body needs for so many chemical reactions to take place in the right way. So CoQ10 and omega-3 are really good for someone that's going through this cardiovascular or metabolic continuum here. So the first one we use is that's targeted. So the ones I'm going through today are really more targeted. These are orthomolecular products. They're a really good company. They're professional grade. They sell to healthcare providers because they want the providers to give the information to the patient. They're not direct to consumer.
These aren't Amazon products you're going to be able to go buy.
And if you find it on Amazon, it's going to be over expensive because somebody's overselling it, or it's going to be the wrong product and it's going to be counterfeit bootleg kind of stuff. And so I really urge my patients, trust me with your healthcare. I don't upcharge. I charge what they ask me to charge. There's minimum prices for this stuff. So we actually have discounted programs. If you're in our Empower program, we actually discount this stuff. And we do nice things. Like if you go into one of our programs, we discount your stuff forever. So we want you to take the right stuff. So the first ortho product is called CM Core. So Cardiometabolic. This is the core one. Okay. So this one I can use a multi-dimensional support for cardiometabolic health. Basically, I can help with energy, support blood sugar balance, support healthy cardiovascular levels. But basically what's in all these products have multiple things in them, because if you took just one of them, I'd have to give you like 5 supplements for this one, right? So these are all been studied, the amounts that they're in, the potency values that they're in. But really what the CM Core has is it's berberine, which is a plant extract that's been used in Chinese and Ayurvedic medicine for like 2,500 years. It has so many health aspects, but it really, really helps the cardiovascular system in synergistic ways to supporting heart contraction, rhythm, that kind of thing. It helps with blood sugar balance. We use alpha lipoic acid. So those are the main drivers of CM Core. ALA, alpha lipoic, is really good for blood sugar. I use it a lot for diabetic neuropathy too. So, if we look at berberine and its many uses within the body, it maintains healthy cholesterol, triglyceride levels. It really affects the gut in a good way for blood sugar and cholesterol. So it's like, wow, I can use that, and it works really well. It reduces body fat, increases glucose uptake in the cells, blah, blah, blah. It's basically backed by so much clinical research that I use that, and it's just like done. All right. You got prediabetes. If you're only going to take one thing, just go with CM Core.
At least get the core.
Right. Getting specific, with those biomarkers of metabolic syndrome, prediabetes, one of them's elevated cholesterol, right? So the elevated triglycerides, bad cholesterol, not good, and low good cholesterol, HDL. So a lot of people take statins, right? And in the functional realm, I'm not a fan of everybody on statins. I just think it's not the root cause of the issue. But I found this product, and this is actually one of the drivers of why I use companies like Ortho, is they have a product called Bergamot, BPF. That just stands for bioactive polyphenolic fractions. So we say BPF.
I would go with BPF, yeah.
Because some people have heard of bergamot. It's a fruit that's grown in a specific, it's a citrus plant that grows in a specific exclusive place in southern Italy. So that's the only place it grows. But people, it's in essential oils, so people have heard of it.
Gotcha.
So you can't just like drink essential oil bergamot. This is like fractionating it down to the thing that works well. But bergamot works really good for cholesterol balance. And it works with statins. So it's like, oh, I'm trying to reduce my cholesterol numbers and improve them. And there's even clinical studies on this one. So statins lower CoQ10. So that's a drug nutrient depletion. I put everybody on a statin on CoQ10. Bergamot works differently than the statins to reduce cholesterol. It really supports healthy CoQ10 levels, but it maintains healthy cholesterol levels, even if they're in normal range. I found that they've done a few studies on it, on this specific product, which is really hard because a lot of nutritional products don't have studies. But they did this one with Crestor, and they showed that it improved triglyceride levels better than Crestor, because Crestor really pulls the LDL, HDL, and it was equal to Crestor. And then when given with Crestor, it actually improved the numbers better than with Crestor by itself. So if someone's statin resistant, they can talk to their doctor or me, and we can come up with a plan. But I've put a lot of people on bergamot, and they've been able to reduce and get their cholesterol numbers where the doctors are happy without statins and sometimes with statins. But this is like, it's a no-brainer because some people would take red yeast rice, but that's a mini statin. And so it's going to do the same side effects. There's increased risk of Alzheimer's with statins now. There's some other things going on. Doesn't mean that they're not for some people, all right? But I think we can do it in other ways, because if we're using things like bergamot, that's really getting to the inflammation cascade of the cell and the arterial wall. That's where we're really doing the work. It's not the number, it's what's going on. So we use bergamot a lot. I think it's a great one for blood pressure. Most people, if you have elevated blood pressure, what do? You go to the doctor. He tells you to take a pill and maybe exercise, right? Those are the things we know. But there's so many nutrients that can be beneficial to the body's blood pressure. CoQ10 can lower blood pressure. Meditation can lower blood pressure 10 points. So we can do these things. But I use a product in our program called Citrinox that is really good multi-use, got some different things in it. But the main driver is citrulline, which is a component that really helps the body's nitric oxide levels to help dilate the vessels, basically helps blood pressure. And we use citrulline because a lot of people think of arginine. So citrulline is the precursor to arginine. So basically it converts to arginine, which is improvement of the arterial walls and the vasodilating and improving the blood pressure. But so why not just take arginine? Well, because it's chewed up in the gut, it's not available to the tissues. So people that take arginine don't get all of what they take. So citrulline isn't chewed up in the gut. So we use the precursor. So that's why this one is scientifically more smarter, I guess, to take for something like supplement, because I'll just take arginine. Well, the citrulline actually makes it work better. There's quercetin in here, which is awesome. It's a flavonoid found in a variety of fruits and vegetables, but it's a potent antioxidant. It really works well to maintain the inflammatory balance, which again can improve the cardiovascular system and usually for blood pressure. And then I use some specific kind of grapeseed extract. That's the kind of the three components in there. And that's got studies that show that people that supplement with this particular product maintain healthy blood pressure levels. So these are things that are scientifically relevant with documentation. We don't make claims with supplements, right? That's the FDA doesn't want us to do. But I can show them the studies that said if you take this specific thing in this combination, it has been shown to reduce blood pressure. Therefore, ... this is why we use it. So we're not making the claim, but we're saying this evidence supports using it. So we got one for blood pressure. We got one for cholesterol. We got one for general like prediabetes and metabolic syndrome. And then I've got one specifically targeting healthy blood sugar levels. So if we're really trying to drive that A1C, which is the marker for 90 days of blood sugar, or trying to get that blood sugar below 100, get that fasting blood sugar into the 80 zone, so we can say we've reversed or helped this chronic condition. We use a lot of stuff, but especially diet, right? We got to put that on that food plan. But this one is really good. It's called dioxanol. It's another ortho product. I'm not paid by ortho. I just use their products in our programs because they have really good functional stuff. This one's got predominance of biotin, which has been clinically shown, B vitamin that plays a role in energy production and helps with metabolism. So really important. Chromium's really important, especially a specific kind of chromium. It's called GTF, glucose tolerance factor chromium. Helps bring uptake glucose into the cells, which again helps with blood sugar balance. I mentioned alpha lipoic and the CM core. It's in this one too. It's super great for diabetic control and for diabetic neuropathy. Cinnamon bark's in there. They use one that's called Sinulin, helps on maintaining healthy blood sugar levels. So again, we're getting synergy. It's not just, let's take biotin or let's take chromium. If we put these things in combinations that have all been studied together And then the last product in this one is a thing called Vandal sulfate, which is a form of inorganic form of vanadium, but it's a mineral shown to mimic the action that insulin plays. So again, we've got this synergistic approach to all of these products contained. So, there's what, 1, 2, 3, 4, 5 different things in one product. So we're getting 2-fers and 3-fers in synergy because it's not just one thing. Again, remember we're affecting blood sugar, or we're affecting biochemistry, right?
Mm-hmm.
So it's not one mechanism that fits for metabolic disease. So we've got to improve all those biomarkers by coming up from different angles. So that's why I use synergistic products, because they've been studied. They just don't put all this stuff. The package inserts that I give people, the education that explains all these different products, this one here has 24 references that are medically, so you can look it up. You can say, all right, here's all the stuff. This is why we put this stuff in here. So these things have been vetted, and I know about them. That's why you get what you pay for. So good food, good signals, great supplements really are the foundation for the plan, and we target it. So, if we're checking boxes here, but if we're going to target blood sugar, we're going to use specific things. So I like to tell people, rely on me for that.
Let me be what I'm good at.
That's the not Dr. Google thing, right? We don't want people to go and Google their healthcare. There are things we can do like eating the right cardiometabolic diet. What is that? Okay, you can Google that. We've got it at our store. We'll give you the sheet that shows you what it looks like. But we got to do some of the biomarkers and testing. But again, next step is if I have a condition that I want to help more with the biochemistry side of things, or just basically helping the body work through it better, then these are kind of the products we can use, So that's kind of where we're at with that one. I just wanted to make sure people understood the importance of nutritional products, I guess, supplements. I call them nutriceuticals because they're nutrition and they're ceutical, right? They're like drugs, but they don't act like drugs. They act in the body the right way for these signals to really help themselves. So
they're more of an aid rather than a mask.
Yeah, well, it doesn't block the symptom or the mechanism of action, but these all help biochemistry. So you need magnesium for 400 chemical reactions in your body, right? Magnesium doesn't block something, right? It's not a HMG coenzyme reductase inhibitor, right? That's what a statin is. Mm-hmm. It's a modulator, so it dims the switch on or off in the right way. So we're putting in good signals. Again, functional, take away the bad stuff, put in the good stuff. Simple but hard to do. Yep. So that's it, guys. That was just kind of a rundown on our supplements for cardiometabolic disease. And if you have any questions about them, feel free to stop by. Connie, our nutritionist, is there 10 to 6, Monday through Friday. We've got these supplements in the store. We got all the patient information you need. So if you even just want to read up on it, just come by the store, let us know. And if you have any questions, let us know. But we'd like for you guys to please tell your friends if you like this stuff. We want to know more. You can message us too and give us health topics that you want us to talk about too. We really enjoy this. This is how we're going to build our wellness community in 2020. That's about it. We will see you guys later. My name is Josh Rimany. This is your Functional RX podcast. And until next time, stay well.